Good afternoon. My research paper is entitled Association of COVID-19 to Clinical Profile with Maternal and Neonatal Outcome of Pregnant Patients Admitted in a Tertiary Government Hospital from March to December 2020. I am Baby Hajria T. Basur, a Medical Officer 3 from Vicente Sotto Memorial Medical Center. The physiologic demands of pregnancy bestow an increased risk in acquiring SARS-CoV-2 infection. However, there are no studies which provide concrete proof that these women are more susceptible to COVID-19. Study findings show that they are more likely to have comorbidities or underlying conditions. In this regard, this study was done to determine the association between COVID-19 to clinical profile with maternal and neonatal outcome of obstetric patients. This study will provide healthcare workers with the foreseeable challenges of a pregnant woman afflicted with COVID-19. Thus, proper measures can be instituted that will improve the delivery of care to this high-risk population. Moreover, the findings in this study will assist health institutions and stakeholders to prepare adequately and reroute resources and manpower to where it is needed the most. This study would like to answer this question. Is maternal COVID-19 associated with poor maternal and neonatal outcomes among pregnant patients admitted in a tertiary government hospital from March to December 2020? And this is my general objectives and my specific objectives. Cross-sectional design was used in this study. Medical charts of pregnant patients admitted from March to December 2020 were retrieved together with the SARS-CoV-2 RT-PCR results. These are my inclusion and exclusion criteria. Stratified random sampling with probabilities proportional to sampling size was done using an electronic random generator. From 2,356 obstetric patients, 12% tested positive for SARS-CoV-2. From these, we were able to calculate 152 samples included in the study. As shown in Table 1, the mean age of admitted obstetric patient was 28 years old, mostly residing in Cebu City. The largest number of patients finished secondary education, while there were only few patients who never had a formal education. In this investigation, only few had comorbidities. A significant number of patients had hypertension, and none of them had cardiac problems. These may have played a vital role as to why this patient did not appear severely ill. Only 24 pregnant women tested positive for SARS-CoV-2 RT-PCR, comprising 16% of the population. In this study, no association was found between maternal COVID-19 status and obstetric complication, mode of delivery, indication, anesthetic use, and maternal disposition, which all showed a p-value of greater than 0.05. There are very few incidences of obstetric complication and were even found to be higher among those who tested negative. The percentage of preterm birth was the same in the general population, which does not conform with the case series and meta-analysis study by Akhtar et al., wherein the risk of preterm birth was high and occurs in more than 40% of cases. It also shows that it is twice higher compared to the general population of pregnant women, whereas in this study, none of the positive mothers had PPROM. With regard to the mode of delivery, cesarean section rate was high at 9.2% and the same for both populations. It is mostly done under spinal anesthesia and delivered secondary to obstetric indication. In contrast with the study of Wu and Sohele et al., where abdominal deliveries were higher in COVID-19 mothers, as they may have required delivery to improve maternal status. In contrast also to a systematic review by Zayagham, where more than 90% delivered by cesarean section. As a tertiary government hospital, it prioritizes admission of high-risk and surgical patients, which could explain the high cesarean rate. Most of the patients understudied were discharged well and or quarantined. Only one tested positive who succumbed to death secondary to underlying condition, which resulted from a complication of hypertension. In contrast to a cohort study in Washington, where high risk of morbidity and mortality was associated with SARS-CoV-2 infection. None of the neonates tested positive for SARS-CoV-2. More than half of them were not tested as it is not mandatory upon delivery. Neonates were only tested if delivered from a positive mother and or if symptomatic. This is incongruent with the studies of Lee and Zhu et al., where all of the newborns delivered from an infected mother yielded a negative result and were clinically stable. In this study, there was no association between maternal COVID-19 status and fetal condition, maturity aging, birth weight, and neonatal disposition. The outcome of patients of infant newborns from infected mothers appears to be good despite prematurity, as evident also in a study of perinatal outcomes in Africa, wherein neonatal mortality was also rare. Based on the foregoing findings disclosed in this research investigation, the main proponent forwards the following conclusions: that obstetric patients admitted from March to December 2020 had a mean average of 28 years of age, mostly residing in Cebu City and have finished their secondary education. Only a few of the patients admitted had comorbidities, with hypertension as the most common. Obstetric complications were not associated with maternal SARS-CoV-2 status. This was also observed with regards to their mode of delivery, indication, anesthetic use, and maternal disposition. The results indicate that pregnant patients who tested positive for SARS-CoV-19 did not exhibit any life-threatening conditions that may otherwise compromise the pregnancy. COVID-19 infection was also found to have no association with severe neonatal outcome. In the current research done, fetal condition, aging, birth weight, and disposition has not been affected by SARS-CoV-2 status of mother. Similarly, the results indicate that COVID-19 had no significant impact to the overall health status of neonates. Recognition of these helped practitioners in proper management of obstetric patients and not to overlook other underlying conditions of patients so that can be managed accordingly for better outcomes, together with strengthening infection control and precautionary measures for COVID-19. For the congestion of patients in our institution, which is identified as COVID-19 health facility, the current service delivery network provided can help SARS-CoV-2 infected mothers need not to be automatically referred as long as the case is manageable. In the sub-epic hospital, provided that standard health protocols is also being observed. And these are my recommendations. Based on the foregoing findings of this research investigation, it is recommended that while studies was found that COVID-19 infection among mothers had no association between maternal neonatal outcome, it is still important that those mothers are closely monitored and evaluated. This is seen to be of benefit to the mother and neonates, since potential problems related to pregnancy are addressed at the soonest possible time. Understanding the long-term effect of SARS-CoV-2 infection in mothers and how this affects future pregnancy is very highly suggested as a topic to be explored in the near future. The researcher recommends to study on the severity and symptomatology of COVID-19 infected mothers and to include the treatment given in association with their final disposition. A study on the possibilities of vertical transmission in neonates is recommendable with the use of serial tests and evaluation of placenta and amniotic fluid aside from SARS-CoV-2 RT-PCR swab, where prospective study is more feasible. That's all. Thank you.
Buenas tardes. This afternoon, I'm going to present to you my research entitled The Prevalence of Suicidal Behaviors Among Patients Referred to Zamboanga City Medical Center, Department of Psychiatry during COVID-19 pandemic. I am Dr. Sheila Midi Adeviso, Medical Officer for Zamboanga City Medical Center, Department of Psychiatry. The coronavirus disease 2019 pandemic has caused global health crisis with significant mental health consequence associated with suicidal behaviors, hospital admission, and referrals to the psychiatry department. The profound psychological and social effects of it led to the development or exacerbation of depressive, anxiety, and other psychiatric disorders among vulnerable groups and those with pre-existing psychiatric condition. Primary clinicians see a large portion of these patients, which suggests an approach to seek case finding based upon risk factors. However, there are only few data and researches done on the suicidal ideation and behaviors among patients. The Western Mindanao Police Regional Office 9 has documented a total of 107 suicide-related deaths in the Zamboanga Peninsula, of which 83 are males and 24 are females. From January to December 2020, the month of October registered the most number of suicide-related deaths with 16 suicide incidents recorded. Out of the 107 suicide deaths, the 21 to 30 years old has the most number of suicide incidents at 26. Hanging by ligature is the most common suicide method locally. Thus, a prevalence study on suicide attempts and the non-suicidal self-harm cases referred and admitted during pandemic period can provide a baseline epidemiologic record of suicidal attempts at NSSH in Zamboanga City, basis for policy making, clinical assessment, and intervention monitoring, as well as effective preventive strategies, especially among identified vulnerable groups that are seen in the hospital setting can be done. This study aims to determine the prevalence rate of suicidal behaviors among patients referred to Zamboanga City Medical Center Department of Psychiatry during COVID-19 pandemic from January to December 2020. Specifically, the social demographic characteristic of patients referred, suicidal ideation and suicidal attempt, the methods of suicidal behavior, psychiatric morbidity diagnosis of patient suicidal behavior, and the referring department of patient suicidal behaviors through consultation license psychiatry referrals. This is a cross-sectional retrospective chart review study utilizing the total count purposive sampling. Chart reviews of admitted patients with suicidal behaviors through consultation license psychiatry and emergency room department referrals were done. Charts bearing these keywords under diagnostic referrals letters were reviewed. Sample population of the data include the following inclusion and exclusion criteria. The study was conducted at Zamboanga City Medical Center, the largest government tertiary and ISO 9001:2015 accredited medical center in Western Mindanao with 45-bed mental health facility and a total of 800-bed capacity. It caters to patients in Zamboanga Peninsula and nearby provinces and Borneo Islands. The data gathered were tallied and coded using Microsoft Excel spreadsheet and analyzed using Epic Info version 7 statistical tool. Results revealed that from January to December 2020, the CMD Psychiatry Department have received 97 referrals from other medical departments. Out of the 97 referrals, 75% came from the non-COVID wards and 25% came from the COVID ward. A total of 37 or 38% prevalence rate of referrals predominantly from the non-COVID wards indicates suicidal behavior. Of the 37 referred patients with suicidal behavior, 54% are males, while 46% are females. SADAX and colleagues noted that men comprise most of those who attempt and complete suicide as they demonstrate higher suicide rates than women at all times across regions, ethnics, and socioeconomic groups. The plethora of evidences associates male suicidal behaviors with triggers such as joblessness, unemployment, failure at work, relationship strains, depression, hopelessness, and substance use disorders. Prevalent age group with suicidal behaviors are of 22 to 40 years old at 46%. Age grouping was based on their expected age-related psychosocial functions and activities. SADAX emphasized that men's suicidal behaviors peak after age 45, while women's completed suicide is most remarkable after age 55. Further onset of adolescence is a suicide-prone period and associated with adolescent crisis, where a period that there is a synchrony among physical, psychocognitive, and psychosocial development that may limit their ability to perceive and judge risk effectively and may result in adolescent views that are incongruous with parents or guardians, hence are propensity to act upon on impulse to perceive stressors. Of the 37 referred patients with suicidal behavior, 46% are married and 54% are single, of which 7 or 19% are children. Based on the established risk factors, single and divorced individuals have higher risk of suicidal behavior. They may be, however, most referred patients with suicidal behaviors in our study were married with little difference in the single group. However, limited to the study is the real relationship with their partner. They may be married, but their relationship with their spouses may be strained or tumultuous that might contribute to the stressors that trigger their suicidal behavior. Majority of the referred patients' educational attainment with suicidal behaviors are of elementary level at 38%. Noticeably, this is closely followed by those who graduated from high school. Like social status, those who reach higher educational attainment and those who have not been able to progress into their education have higher risk of suicidal behavior. This is associated with different levels of stressors encountered in terms of employment opportunity, coping, emotional, psychological, and social building capacities, and their level of cognition and intellectual capacities. Among the 37 referred patients with suicidal behavior, prevalent are Bisaya, followed by the, at 46%, and this was followed by a 35% Zamboangueño, 14% Tausug, and 3% Yakan, and those who has unspecified ethnicity. Zamboanga City is highly urbanized and a melting pot of various ethnic groups and cultures in Zamboanga Peninsula. It has become home to more than 800,000 people and became an established economic center of the region. Thus, migration of the different ethnic groups from different provinces resulted in many other ethnicities to coexist and thrive in the city. Despite this result, there are minimal studies that correlate different ethnic groups with their suicide rates in the local setting. However, it has been established that immigrants have higher suicide rates than those native-born population. Roman Catholics have the highest numbers of referred patients with suicidal behavior, followed by the Islam and other Christian denominations. Zamboanga City's history of Spanish colonization and the influence of Christianity explain Roman Catholics' predominance in the city. However, this does not cover the many confounding variables about one's religious affiliation. This includes the spirituality and faith-based practices and beliefs of each individual affecting their perspective on death, suicide, and self-harm. As suicide and self-harm are not universally accepted in all religious sectors. However, various studies have shown greater confounding variables that could not establish a conclusive association between religion and suicide attempts. The majority of the deferred suicidal behavior were coming from Zamboanga City at 62%. They can be native and migrate residing permanently or temporarily, while some are just doing business for a time. Since this study involves short review only, the declared addresses of these patients may not necessarily indicate their permanent address, as some of these patients may have been stranded only or temporarily staying in the city due to the enhanced community quarantine lockdown at the time. Despite that, most patients that were referred with suicidal behavior were residing in the city before their admission to the Zamboanga City Medical Center. Most of the deferred patients with suicidal behavior were unemployed at 51% at the time of their admission. Moreover, there were referred patients who are students and pupils who have suicidal behaviors. Unemployment is an established risk factor for suicide attempt or behavior that would likely contribute to the propensity of suicidal behavior of these referred patients. However, the number of adolescents doing heavy suicidal behaviors apparently currently associated with adolescent crisis and their impulsive response to identified stressors. On the 37 admitted patients with suicidal behaviors, 22 or 59.5% had suicide attempts, while 40.5% had suicidal ideation only. These results showed that the proportion of referral with suicidal attempts is significantly higher than suicidal ideation during COVID-19 pandemic period from January to December 2020. This shows that amidst the fear concerning the COVID-19 infection, the government's measure to contain transmission and increase of cases, individuals' mental health suffers. Hence, vulnerable individuals resort to self-harm and suicide attempts, while some continues to suffer from suicidal ideation, which is a definite risk factor for suicide attempt and completed suicide. Stabbing was found to be the most prevalent suicide attempt at 32%, contrary to the method of hanging by ligature as the method utilized in the completed suicide locally. Environmental setting and accessibility to things that can be used in suicide attempts, an individual is exposed to determine the suicide method they would likely do, whether it is a planned or an impulsive suicide. Among 37 with suicidal behavior, 42% had depressive anxiety disorder as the most prevalent. World Health Organization has long predicted the rise in the number of mental health problems due to the global pandemic. Uremovic and colleague emphasized that those who are affected by quarantine, regardless of their health status, are learning to report distress due to fear and risk perceptions. This pandemic has been associated with mental health challenges related to the morbidity and mortality caused by the disease and the mitigation activities, including the impact of physical distancing and stay-at-home orders. Strong restrictive measures to avoid COVID-19 infection have led to loneliness, loss of job, and loss of access to health, which may precipitate or worsen existing mental health problems. Vulnerable individuals, on the one hand, might likely develop mental health illnesses from these COVID-19 related stressors. Patients who are already suffering from mental health illness cannot access healthcare services due to the existing lockdown measure and the fear of contracting the virus while seeking healthcare. Hence, there is a heightened tendency of the emerging prevalence of mental health illnesses in any disaster or pandemic. Out of the 77 charges referred with suicidal behaviors, most were referred from the surgery department at 32%. These results show that the most referred patients with suicidal behavior have been managed mostly by surgeons, as these patients had attempted suicide or did self-harm that requires surgical management that's suggestive of the highly fatality nature of their attempt. In August, there was a significant increase of total Zamboanga City gradually transitioned from ECQ to GCQ last July 16, 2020, with the reopening of borders and establishment allowing movement of people. This reflected the peak admission and referral of patients with suicidal behaviors from in the emergency department. In the last quarter of the year, starting in September, referrals of patients with suicidal behavior from the other medical departments decreased. Despite the decline in the referrals of patients with suicidal behaviors, there was significant report by the Police Regional Office 9 of the number of completed suicide in the Zamboanga Peninsula in the last quarter of the year. For the conclusion, COVID-19 pandemic period from January 20 to December 2020 has shown persistent of admissions and referrals to Zamboanga City Medical Center Department of Psychiatry of patients with suicidal behavior despite decreased to no-referrals in months when the lockdown was declared and strictly implemented. There are 38% prevalence rate of referred patients with suicidal behavior from the non-COVID ward to the psychiatry department for the period of January to December 2020. The prevalence socio-demographic profile referred patients with suicidal behaviors are males, 30 to 40 years old, married, Roman Catholic, Visaya, elementary level, and unemployed. The proportion of suicidal attempt referral is significantly higher than the suicidal ideation referral, with stabbing as the most common method of suicide attempt. The most prevalent psychiatric morbidity among these patients is depressive anxiety disorder at 42%, and the surgery department has the highest number of referred patients with suicidal behavior at 32%, followed by the emergency department at 27%. The highest number of referrals resulted in August when the Zamboanga City already shifted to general community quarantine status. Therefore, this study recommends a longitudinal comparative correlational study of the cases referred with suicidal behavior to be studied with at least a 5-year time frame. This is to ensure rich data on the trends, increase and decrease of suicide behavior cases and identify the contributing factors and circumstances during the study of suicidal behavior. Correlation on the suicidal risk factors, suicide attempts, and addiction and psychiatric morbidity diagnosis can also provide meaningful associations that may be used as a complete basis for mental health awareness suicide prevention efforts reflective of the sample population. Studies on the prevalence of suicidal behavior among patients seen at the outpatient department are also recommended. Further, there is a need to establish policy-making body in creating a binding, responsive, equitable, and sustainable efforts to address the mental health problems and emergence of suicide and self-harm cases amidst any disaster or pandemic. Community-level intervention prevention efforts, including health communication strategies designed to reach vulnerable groups at the grassroots level, intensification of telehealth, telepsychiatry services, mental health and psychosocial support, and socioeconomic programs can prevent exacerbation of mental health illness, provide alternative access for mental health care, and integrate suicidal behaviors and hospitalization while preventing exposure to COVID-19 pandemic and infection. With this, thank you very much for your attention, and these are my references. Thank you very much.